Thursday, day class, continuing to set up, strokes, positioning, and chakra balancing.
Yeah. I forgot. It's not even the feet, it's that knock your socks off.
You gotta say, I'm gonna prepare your feet for your massage.
I'm gonna knock your socks off.
Now just think how awkward you feel. That's the first time you've peeled your feet off, right? That's what the client is feeling. They're embarrassed, they're worried, they're scared, their feet. Some places there's a lounge where they can shower. Other places it's like a day spa, they don't. They have to come from the street, take their clothes off and get a massage. Yeah. Now, the safety rule is you're never going to let them get off that table with oil on their feet, okay? Usually we're going to use a hot towel to clean the foot at the end of the massage, but if you don't have a hot towel, you're going to have to put a little alcohol in your hands, and alcohol is the only thing that cuts the oil, and clean it, okay? Very important safety rule, especially in here we got slick tile floors. Plus, the worst thing you want them to remember is the squishy sound their feet make as they squish around in their shoes, because you left oil all over them. All right, stand. Everybody stand on the same side of the table so we don't bump butts. Get on the right or the left. Now you're going to need to put your product away, hon, because you're going to trip over them. They're still on the floor. Put them up on the table. And put that stool out of the way. You want to be able to walk around safely and comfortably. Let's practice some stances before we start rubbing. So tell me what the 3 stances are that we have in massage.
Asymmetrical, archer, horse stance.
There you go. That's it. And how are we going to make sure we're protecting our back? How are we going to stand? How are you going to stand when you do these strokes? You're going to sky hook.
Pelvis tuck.
You're going to tilt your pelvis posteriorly, so you pull the weight back against your spine. How close together can your feet be? Shoulder width. I don't want to, even when you're just standing around, don't stand like this anymore. You stand like this. See how much more comfortable that is? More grounded you are, closer to the floor. And I want you to start rocking. Let's get in the habit of rocking your weight back and forth, okay? Now, when I lift my hands up to do anything, where are my elbows? So if I got to come forward and I can't do that, what do I have to do? I got to bring my body forward, right? I can't stand here and do that. So forward is the horse. So you bend the knee from side to side to use this hand and that hand forward, okay? If I'm traveling, what stance? Archer. Archer. If this leg is back, which leg is leading? Opposite. You make a triangle between you and the person, right? A triangle. Now, even in that stroke, you don't want to let your elbows leave your side. So how do I keep my elbows at my side and travel? My body moves, right? I got to move. Don't stand here in your archer and go like this. If I got to go forward, I got to bring my whole body forward, okay? Where does your power come from? Your back foot. So I don't want to see you do this when you're doing a stroke. You just took all your power away. You push into the floor with that back foot, okay? It stays down on the floor at all times. I could take the front one up off the floor. I don't really need it, right? If I do this, do I even need that front leg? Not really. Not really, right? And that's where my power's from, okay? All right, now don't rub hard because they've got fabric on. But we have, how many ways can we manipulate their body? We got 7. Let's start with effleurage. That just means you're shear, it's a shear force, so you're just gliding along. Anything that's just gliding along is an effleurage. Now don't rub hard, okay, because you're doing it through fabric. And when you're doing just the regular effleurage, let them feel the entire surface of your hand. So you're just resting your hand on them. And your hand is like it's a tool, it's a spoon or something, because where all the control is with your body. But you don't want to hold your fingers up stiff, because you're going to hurt by the end of the day. And you don't want to be this timid little, they feel this little, you're not sure what you're doing. Then they think there's a fly or something on them and they want to swat it. Contour. Now I can put one hand on top of the other. I can do it with just one hand. I can have two hands. It's however way you want to do it. But if you're sliding along, it's effleurage, okay? Now we can do effleurage a couple of different ways. Just use the full hand. If I come up on my fingertips, I'm raking. It's like a little rake. But it feels good. Raking feels good. Doesn't that feel good?
Yeah, it does.
So raking is you come up on your fingers. This feels great between the ribs. So I want you to do the ribs because the little muscles in there called the intercostals, they need to be relaxed. We need to help people breathe. We want them to breathe deeply. It's called diaphragmatic breathing. So you need to do it, but the person on the table needs to do it too.
Are you sure? Okay.
So I can reinforce it and I can make a double rake. Double rake. Or I can do one hand and then the other hand. Or together. So the rake can be done a bunch of different ways, can't it?
So I'm breathing. So we just go like that?
Not so much on the anterior side, especially for a lady. But when she turns over, I can do this. Yeah.
Okay. So you're just telling us.
Yeah, just notice. Now, like a roof has shingles, and we use that term because it's overlapping movement. And we usually do that when we do the ending, the nerve stroke at the end. Do this, right? But as long as one hand is following the other, like the shingles on a roof, it's a shingles.
Is this usually more gentle? Is it just like a down?
I can do it deep. Don't have to do it gentle. But that's how you would do your closing nerve stroke. It's always a, but yeah.
Is it a downward flow? Like
It can be going down, it could be going up, it could be going across. As long as one hand follows the other, it's a shingle.
Okay.
I can do this,
That's a shingle?
because one is following the other. Yep. Lots of different ways, right? But you're just following along. Now, later we're going to do what's called thumb rolling, which is just a shingles with your thumb. So there may be just one or two basic ways to do it, but you can vary those. Can I do an effleurage with the back of my hand?
Yes.
Can I do it with my knuckles?
Yes.
Can I do it with my flat part of my fingers?
Yes.
Yes. Makes it feel different. This little guy right here is a great tool, especially when you're sliding along. It just feels so comfy, nice and soft. So I'm letting him just feel just that. The rhythm will come later. Let's not worry about rhythm right now. Let's just get the strokes down, okay? Don't hold your fingers up hard like that, honey. Let it relax. Yeah. You have to use a relaxed hand. You'll never make it if you're holding your hand stiff, okay? All right. I know it's an effleurage because I'm gliding. I'm gliding. Now this one is the powerhouse of massage. This is what gets in there, loosens everything up, gets the blood flowing, and that's petrissage. How would I know I'm seeing a petrissage? Kneading and squeezing, okay? I'm putting some pressure into the muscle, and I can do it a bunch of different ways, right? And if I pick up some tissue with this hand and then pick it up with that hand, but it's the same spot, I'm just working that same spot over and over again. That's two-handed alternating petrissage. But I can do just one hand. It doesn't have to be two, right? Just one. Now, if I don't overlap them, two-handed petrissage is you use two hands, but you don't do the same spot at the same time. Okay. If I'm doing this, that's two-handed petrissage, but I'm not moving it back and forth, right? As long as it's being squeezed somehow, some way, there's pressure being put on it, it's a petrissage. Okay? Now, the best way if you're really doing rehab in Eastern is they do broadening and lifting. You don't have to do them together. You can do them separate. How would I know I'm looking at broadening? What am I looking at if I'm looking at broadening? The muscle's being squeezed against itself and pulled off the bone, right? You're trying to make it as wide as you possibly can. Wide as you can. Not really. That was more of an effleurage. Broaden. Broaden. You don't need to use your thumb. You can use this to broaden. Okay? Take the muscle and try to pull it apart. That's what you're trying to do. Pull it apart, right? That's good. That's it. Pull it apart. Now on the arm, pick their arm up. You can do it really good on the arm because you can hold the whole thing. You can put your fingers behind it. Just let your arm relax. Okay. And now you can really pull that muscle apart. Right? You can really do a good job. If you're on a smaller area, put your fingers underneath, put the arm in your hand like this and pull it apart. And the opposite of that is lifting. You're squeezing the muscle against itself, but one way you're widening the muscle, the other you're just lifting it up. And you can do it with your fingers like this if you want. Squeeze it and pull it up. It's up to you. Not in that posture, you're not. Open up. Or just simply grab the muscle and squeeze it up off the bone, right? That would still be a lifting.
How do you do it on the arms? No, this one's much closer. The one on the thighs? Yeah.
I would slide too, but I can't because she doesn't have any oil on her. Or I could just simply do that.
What's this?
Yeah, that's lifting. And you can put a little squeeze to it, but yeah. Just lift it away from the bone.
Right. Oh, okay.
Pull it away from the bone. Now, Oriental work doesn't use oil, so there's a petrissage you can use where you don't use oil. They push away and pull back. Push away and pull back. I can alternate it. Kitty cat, right? So I don't need oil. I don't. No sliding.
Like that?
Push it away and pull it. Anybody make bread in here?
No.
You ever knead bread? You push it away and you pull it back. You push it away and you pull it back. That's how you knead bread, okay? Now, the way to really work the muscle and get a lot of stuff moving at once is ringing. Ringing is just one hand comes one way and the other hand goes the other. So you're going like this. Today, just don't slide because you don't have any oil. But normally I would go all the way up, right? It works everywhere. You can do it across the back, you can do it on the arms, you can do it on the legs. It's just when you squeeze and going in opposite directions, that's ringing.
I don't like them.
And you can do this too. Ring like that, okay?
How do you make sure you don't put too much pressure? Because I know you said not to do that, right?
Mm-hmm.
How do you make sure you don't do it when you're doing this?
I just keep it close.
Keep it like this?
Mm-hmm. I don't even have to use my thumb. Not really. Ringing? No, just.
Oh, you put it up there.
Yeah, just
okay,
get it out of the way. You don't have to use your thumb to ring. Take it away. Don't use it. Put it up and just ring like this. Okay? Very effective to loosen up the muscle. Okay? So that's ringing. Now, circular petrissage. Somebody show me circular petrissage. Do you remember? What would that look like?
It goes like this?
That's it, but don't put your elbow away from your body. How can you do it without doing?
Yes.
Can you use your elbow?
You could, but we're not doing elbows yet. It feels good on the feet. feels good on the feet. You can make fists. And just if you're twisting the tissues, it's a circular friction. Now around, you can use one hand or two. It's up to you. What I usually do when I use two hands, because it stabilizes what I'm doing, I'll put my thumb in there. I can use it both at once, right? But circular is with your fist. You can do it with your fist. And we can also do it kind of like the alternating, but you bring your hand around in a circle. Around the neck, this is what you're going to do. It's a circular. You grab and pull this way, and you grab and pull. But you got to go in a circle to get around the neck, right? And you want to go around the scapula and work around the edge. You got to make a circle because it's a curved surface. But that way you can do anywhere. You can do that fist thing anywhere. It feels really good in the hand. Grind it in there. Feels really good. Now, vibration is the stroke that takes the most, because you have to tighten your muscles to vibrate. There's no way around it. You got to do this to make them shake, right? But the easy one is rocking. It's shaking because you're going side to side, but it's easy. I just push and pull, push and pull, push and pull. That one's the easy one. You can start at the hip, pull them towards you and push them away. Towards you, push them. And you can take that down their legs. I can go up a little bit and stop, go up a little bit and stop. Just make it feel different, right? Now with women, don't go up past there, okay? You can come up on the rib cage a little bit, but not much. So here I'm just going to go like that, but that's as far as I can go. And the hips you can really get them going at the hips, right? Because you got something to hold on to. So that's shaking. What's the definition of shaking?
Rocking.
Side to side.
Side to side.
Okay, what's the opposite of that? Up and down. And what do you call that? Jostling.
Jostling.
So if I want to do this, up and down, that's jostling. So just pick it and shake it up and down, it's jostling.
Coach,
That's okay, you can do that too for the whole leg. I can do it gross when it's, really hard, the whole thing, or I can do it a little tiny up and down. Little tiny up and down. So they're really tight muscles, especially in the arm and the shoulder. Beat them on the table.
am I doing it right through the arms? Why do we hold it by the wrist? Oh, up here.
You're holding proximal to the wrist. Beat them on. It doesn't hurt. The bed's cushy. Bed's cushy.
It's so weird.
And you could kind of combine them a little bit. Rocky, shaky, rocky, shaky.
You both at once?
You could. So part of what we do is assessment too, right? So if I do this alternating, I'm kind of seeing, is one leg really, really tight and the other one? How are they balanced? Are they, a lot of people, it's going to be a little bit off because people are right-handed or left-handed, you lead that way. But sometimes one hip just won't let the leg move at all. So we're doing this because it feels good, but we're also checking out that hip joint, checking it out. All right, I should have shown you guys this. And part of our assessment too is we want to check their circulation. Where clots start when you have a heart attack or a stroke, that clot came from the leg 99% of the time. That's where it started. The blood built up, it broke loose, it goes to the brain, or goes to the lungs, right? So we want to make sure If you feel one leg has a nice strong pulse and the other one hardly has any at all, what are you going to do?
Work on the one, or check. I mean, that's.
What are you going to do?
Bring it to their attention. She's checking the pulse of the feet.
Checking the pulse. The pedis artery. I can even see that one. Pretty good, pretty even. The top of the foot, guys, that bony thing that sticks up is called the navicular.
Oh, I feel, yeah.
And the first metacarpal, it's usually right there. Just a little lateral on the inside of that bone.
Pulse is good.
That's where it is. And it loops across the top of the foot. And you're just going to do resting hand on there. If you push down, you're going to shut the blood off and see if it feels regular. If it feels okay. So there's the first metatarsal. And I just... That one I found, but this one it's very thin, very... It is? Yeah. Not very strong. It's an even pulse, but it's very, very faint. And they're pretty even, but it's...
I can ask my doctor. Should I have it checked out?
I would. It's not going to hurt, right? What are you going to do, though?
Here, like under the ankle, do you feel
That's
there?
another artery.
Oh, okay.
That's a different one. It's just lateral to that bone right there, and where the navicular is. Sometimes it's on top of the navicular, but it's usually to either side of it.
So the pulse isn't the same for my left.
Yours is hard to find, dear.
But she was saying your pressure is low too, right?
Yeah, she's got low blood pressure. It's very hard to find. Guys, you're going to refer them, aren't you? You're the frontline provider for them. No one else is touching them to tell them. Unless there's pain, they're not going to mention anything to their doctor. And he's not going to just automatically order all these tests for you because he's afraid of getting sued. So a lot of things go undetected for a long time. So how would you refer it? What would you say? You're not going to say it in the middle of the massage, right? After? Yeah, I noticed in the feet that the pulses weren't even. And it would be really a good idea to go and just have it checked out. Just have it checked out, that's all. And bring me the doctor's note when you come back. Because don't put them back on your table knowing they have a problem, right? Knowing they have a problem. All righty. Uh-huh.
If one pulse is different from the other, what you said that causes heart attacks?
What happens with strokes, it's a little blood clot
Right.
that breaks loose and goes. Well, this is where most of the blood clots come from.
Right.
Because blood pools in the legs.
On the floor.
And and then that's where they are, because that's where the best place to grow them is down there, because it takes a lot of effort to get back up the leg from gravity. And if you lead a sedentary life and you're not really strong with your circulation in your lower body, plaque builds up, right? Plaque
Right.
builds up, and then it breaks loose.
And it breaks loose, right?
Yeah.
Wow.
So I kind of want to know. I mean, I kind of want to know what's going on with the leg.
Okay.
And that's resting hand position, right? And you can tell them you're doing energy work. They don't know. And if my thumb is under there, I'm holding their solar plexus and their kidney 1 point, and I'm feeling the pulse at the same time. Everybody feels it here. You got to feel it there. Okay. And you never say, that's where those clots is where strokes come from. And you better go.
It's not very relaxing.
Right now, yeah, they're relaxed now, huh?
So does that mean you have to go to the doctor?
Huh?
Does that mean I have to go to the doctor because it
No.
was fainter? Or?
I can't really feel that. I don't really know because I couldn't get the thing on it. All I know is here, it's even, but it's not very strong. It's what we call thready. Thready feel.
So what's that usually?
I don't know. I'm not a doctor. Go and find out. Ask that question to him. Yeah. Eastern philosophy, they check pulses. It's very important, the pulse. And they have a little thing about how it feels. They do all 12 meridians by where they touch you and how deep they touch you. They can tell. And the tongue. They check pulses and they look at the tongue. They can tell a lot about your health by what the tongue looks like. What the coating is on it, you know, if it's nice and thick or if it's thin and pointy. Does it quiver? Can you hold it still? That has a lot to do with your health. It really does. Okay? So petrissage is squeezing. The word I think means kneading. Petrissage, the original one in massage. Okay? So I'm going to squeeze that muscle whatever way I want. I can use fingers, I can use fists. Do it like that, okay? Now, vibration is either fine or coarse. You can move the whole leg or just the muscle, right? Shaking them up, that's vibration. Now we can also do something called fine tremulous vibration. Feels good along the spine. But if I just take my fingers and start going like that, and I can just travel with it. But the only place I'd really do it is on the back. And I'm not going to do a whole lot of it, but because it does take, you've got to tighten your muscles to do it. There's no other way around it. So I could combine that with my effleurage. I'd shake my effleurage, right? Shake your effleurage, combine the two. Okay. We're going to do an exercise to build up your strength in doing that. We're going to put a penny inside a balloon, and you got to be able to roll it around till the penny starts spinning in there. And then you're doing the vibration the correct way. So we'll do an exercise to get that skill down. So I can do it and trace along the spine, which feels good, right? Fine tremulous vibration. Kind of throw it in. It's not something like I did petrissage everywhere and now I'm going to do vibration everywhere. The only one you do that is the rocking. The rocking feels good all the way up and down, right? All the way up and down. Tapotement. How do I know I'm doing tapotement? I see somebody, I know they're doing tapotement. They're striking the body, right? Anything that strikes the body is tapotement. Now the most powerful one is the cupping. You make a little bowl with your palm, and you want to hear that sound. This is the stroke they use for people who have lung congestion. They're going to shake it, and they're going to cup it, beat it. And you put their head lower so that the fluids drain, right? You're going to want to get it out. That is called postural position. I lower the head, and then I beat the heck out of you, and I shake you to try to get that crap out of there. My granddaughter has asthma, and we have to do that for her quite a bit. And she doesn't mind because it helps. She knows it's going to help. So I'm striking, cupping. Now, flatten your hand out. Now what are you doing? Slapping. Nope, with slap. Yeah. Do it on the feet because the feet like to be slapped. Now, you can do it like this, which is alternating. I can do it together.
Being immature, right?
I can get like a little rhythm to it. 1, 2, 3, 1, 2, 3, 1, 2, 3. Any way you want. Mix it up. Mix it up. Don't do the same thing all the time. Because you can get a nice little rhythm going just by slapping, right? And how you slap.
Playing music or something.
Yeah, it is like music. It is. So that's just slapping, right? It feels good. Now, if you turn your hand up on the edge and you hit them with the ulnar side of your palm, you're hacking. Everybody, sky hook, drop those shoulders, tuck your pelvis, and take a deep breath. You don't need to tighten up to do it. Be careful on the foreleg. That bone sticks out. It's sharp. Don't hit the tibia. I can do it like that too. Right? I can do it together. So long as it's the, don't hit them with the finger. It's the palm, right? It's the palm. Nice loose shoulders. Don't tighten up. Nice loose shoulders.
Oh, you want to do one?
And you still have to stay loose to beat too. So let's beat. You make a fist, but keep your fist loose. Don't tighten up, and beat them. You can do them together. You can do them alternating. You can do just one. You can mix it up, right? But as long as you're using your fist, it's called beating. Need to loosen them up. Sometimes if I bring the leg up and they feel kind of tight, I'll beat the back of the thigh just to help them relax.
I always feel like putting my leg if I get cramps.
You do. I mean, it works. Okay, now you probably will never use this, but this is called quacking. Not a good position for your hand, so it's not a good one to do. But you're going to hit them with your little finger, and because your fingers are loose, they slap up against each other, and you hear that sound. But you're doing it like this, which is not good. Look at your wrist, but this is how they do it. I say chopping. It looks like you're chopping, right? But just hit them with the little finger, not the palm. And leave your shoulders loose and your hands loose. Don't tighten up. Useless stroke. I don't know. I see people do it. I mean,
You don't like this one?
why? Why would you want to do
Why are
it?
you teaching us?
Because it's one of them. I gotta show you how to do it, just in case. Now, if you look at the Oriental stuff, like some of the shiatsu work, that's what they're going to do. They quack. They turn it up and down and use their head. It's not very effective. It'd be much better if you cupped them, right? And then we're just going to pluck a little bit up at a time. Pluck, pluck, pluck. You can call it pinching, you can call it plucking, whatever you want to call it. But you're going to very quickly pick up just a little tiny bit of muscle, a little tiny bit of skin. I might do that to bring a little blood to the surface. They have really cold skin. Get some blood flow going. But just pluck it. Pluck it. Now you want to make it a little more effective, a little more fancy. You're going to twist it when you pluck it. Twist. Take your thumb and just go like that. You can alternate it. But that's squinching. Now, according to the people in Europe that works on cellulite, they have this whole little thing they do. And when I studied lymph drainage, they taught us to do that on the abdomen with the little twisty thing. I don't think it really works, but maybe somewhat. You'd have to like do it for 3 hours every day for 6 months before it would actually move the stuff. But now you notice some parts of the body it just doesn't work, right?
Yeah.
It's too tight down here. There's too much fascia. Don't even try. Works here. Works on the arm.
So it's like super quick. Like it's not like you
Yeah.
don't.
No.
Okay.
Little. And the lymph drainage is little tiny. You just work the abdomen back and forth. So it's a twist, right? It's a twist. It works good on the head. I mean, it does feel good on the head.
Is the plucking the one that you usually would want to do on a smaller part?
You could pluck, yeah,
But
on the
like,
smaller.
I'm talking about like for the femur.
Yeah, why not?
Oh, okay.
and then there's scrunching.
Which one's the one that you should
You
do
said
for a
you-
smaller
Smaller
area?
We were
Yeah,
talking about petrissage then.
That was that.
You go up on your fingers and thumbs.
Okay.
So like right there, I'm gonna petrissage with my fingers and my thumbs. Instead of trying to get my whole hand in there because it's
Yeah.
too small. So those are your strokes. Now what is the last one we're going to do? Oh, I'm sorry, we didn't do friction, did we? All right, friction. How would I describe it? I look at him and I know he's doing friction because there's no sliding, that's true. Is there any twisting? No. I can do circular friction, but I'm not twisting. So if I hold the skin down and don't move the skin, but move what's underneath, that's friction. So if I go like that, that's a circular friction. This is the stroke we use around joints and on tendons. You're going to friction them. So you can use your fingers. So long as you don't slide and you don't pinch, it's a friction. Most people use their thumb for everything, so you can use your thumb, but please try not to. Okay? So if I do it in a circle, it's circular friction. If I go across the direction of the fibers, it's called cross fiber friction. And you're going to do that around joints. I'm going to push her patella up and go like that to loosen up that tendon for her quads, right?
Does it tickle?
Yeah, a little bit. Only on the sides though.
I want to loosen them up before I do that, so I push up a little bit, and then I just go back and forth like that. Cross fiber. If I did it on the muscle, it would look like that. Because these fibers go this way, I'm going to go across them. The arm muscles are going this way, so I'm going to go across. Cross fiber, cross fiber, cross fiber. Dr. Cyriax made this a popular treatment for tendons, tendon injuries. And we just throw it in and we call it cleaning up around the bone. So around your scapula, I'm going to do some frictions. At your joints, I'm going to do some friction. And then Dr. Strong said you can also do it with the fiber, and that's okay too, especially down here. So there's a friction that we call longitudinal. So circular, cross fiber, longitudinal. I know it's a friction because the skin is being held and you're moving what's underneath. You move what's underneath the skin, okay? And that you can throw in with other things. Usually if I'm doing a trigger point, when I'm holding it, I'm vibrating or circular, I'm putting something like that into the movement, but it's up to you, okay? And that works great on the face, especially if it's a man and they've got the beard area. You can't be doing a bunch of this in a beard, right? So you just friction it. Just friction it, okay? And notice on different parts of the body, it's easier or harder to do. Where there's a lot of fascia holding everything in place, it's kind of hard to manipulate down here, right? And then resting hand position. You just rest your hands. Make them relaxed. People want to feel that you are confident and your hands are relaxed. And just rest them on them. Just rest them, okay? You can do it one on top of the other, side to side, just one. It's whatever you want to do. Now when we get to the head, if we're doing any kind of headache thing or anything, we just hold the ears. Hold the ears. It's kind of calming to hold the forehead too. You don't need to put a lot of pressure, just hold. Just hold, okay? A lot of therapists, this is how they start. They'll start the massage by just resting their hands on them. It's kind of an introduction to the person, to their body, introducing yourself to the person, and letting them get used to your touch, and then you start moving and doing your other stuff. So you could probably just start with the hara, just rest your hands there. Then I would probably move into a rock. From here, then I'm going to start rocking. but just hold, okay? Now I could hold 2 of the chakras too. On this side of the body, which 2 chakras do you think you should hold? Definitely the solar plexus, without a doubt.
On the side?
You could do the heart or the minor heart. On some, maybe the sacral, right? Like that. But you can do chakras too.
Are we going to do this?
We are. The first 2, you really shouldn't touch them, the root and the sacral. But when you get up here, you can. If it's a lady, it's your choice. If you think you can do it, turn your hand like this, or just hold your hand above them. If you're within 3 inches of the body, you're still in the physical body as far as energy goes. Okay. And then we'll do some more ranging at another time. All right, since they're on the table, we're going to put you back on the table. Let's do some chakra balancing. Now I have a handout. I have a handout for you on chakras, and this is from Deepak Chopra. Anybody know who Deepak Chopra is? Kind of a famous guy who introduced the Western world into Ayurvedic medicine. He was a very well-known endocrinologist. Was the floor, or whatever you call the head surgeon. And then his father died, and he went home to India for his father's funeral. And I guess he had a midlife crisis, and he stopped doing Western medicine and started learning Ayurvedic.
Can we keep the shoes on this thing?
Don't switch. The people that were on there, where'd you go? What are you doing?
Because I thought the first group you wanted.
No. I said you'll get back on there afterwards.
Oh, sorry. Misunderstanding.
I thought maybe you guys had to go to the bathroom. I don't know. So he's got a really good little thing, little blurb. So your first chakra is self-preservation. It's survival, right? Your second chakra is self-gratification. The third chakra is self-definition. The fourth chakra is self-acceptance. It's unconditional love, right? The fifth chakra is self-expression. The sixth is self-reflection. And the seventh is self-knowledge. So it's all levels of consciousness. Okay, so that's for you. And then this is for you. So whoever's going to be first, might as well let the people without the shoes do it first, right? So you got that. I have one for everybody, but people on the table, you don't need this. You do.
Thank you.
Now, if you're going to try to do the body together, the legs and arms together, ask them to move closer to you. They don't have to be in the middle of the table. If you're going to try to reach out across them, have them move towards you. Now, what side of the table do you need to be standing on?
The right side of the class.
Whichever one makes your left hand superior. So everybody do that. Then have them move close to you. Have them come over to where you are. Okay, I've color-coded it. So you're going to stand with your left hand superior, the client's right side, but just remember left hand superior. Okay. You're always going to lead with the left. So you never let go of you hold both chakras at once, so the right hand stays there, the left hand goes up, and then the right hand moves. So you got, you don't pick both of them up at once, you always got one of them at the same time. But it's always the left hand you move first. So you're going to put your left hand on the contralateral ankle. That's where we're going to start. We're going to include the minor chakras. Now, you can do this when they're prone, too. If you feel a little awkward, if it's a female, you might want to do it when they're prone. Either way. In fact, it's really better when they're prone because this is all relating to the spinal column, right? Chakras aren't actually in the body. They're bringing energy in. It's like a little whirlwind, so it's not inside your spine. It's bringing energy to those points. So the left hand is always going to move first. So everybody, hold the ankles. Put your left hand on the contralateral ankle. Your right hand on the ipsilateral ankle. We're always going to hold it for a couple of breaths. Just a couple of breaths. Now, bring your left hand up to the knee, and then your right hand up to the knee. So take a step up, be level with your work, and now we're going to hold them there. That's the minor chakras are the joints. It's where the energy crosses over. They're neutral. They're not positive or negative. Okay. Now, bring the left hand up to the right hip, point fingers towards the head. Slide your hands up, stay on the side, don't go in the middle, you're on the hip. Okay.
Are we controlling?
So you turned your hands, didn't you? The hands turned when you got to the hip. So you were like this, but now you're like this. So you come up the legs, and then the left hand and the right hand. Now you're holding it like you normally would. The left hand is close to you, okay? But you're on the hip. If you have to lower the table, lower the table. Now you want to keep your hands about 2 inches above the body if they're supine. So bring your left hand to the root chakra, and then put your right hand on top of it. And that's at the base of the body. It's where the body meets the legs. The left hand is always the one that touches them. When we do other modalities that are Ayurvedic, it's going to be the left hand against, like if I were doing a stroke to rub their back, it's with the left hand touching them and the right hand on top. Okay? Now, slide that left hand out from under the right hand, just up to where the sacral chakra is. So now they're next to each other, right? Then put the left hand on the sacral plexus. And the right hand moved up to the sacral chakra. So they were like this, and now they're like this. Here, here. So now you're holding the sacral with your right hand and the solar plexus with your left. If you're on a woman, you're not going to want to touch the chest area, but we're going to do the minor spleen. So slide that left hand forward. And then bring that hand up right there. The right hand is always one chakra behind. When the left hand leaves that chakra, that's where the right hand goes. So now you've got your left hand forward like this on the spleen, right, and you're holding it. They're kind of like this way now. Bring your left hand up to the sternum. If you're on a lady, you might want to stay off the chest. And slide that right hand over to the spleen. So now you look like this, right? You can touch here. You're on the, and he's a guy. Let me show you. You were like this, right? Now you're going to come up here. Wait, right, left. And now you should be holding like this.
Okay.
Heart and minor chakra, okay? So you're on the heart and minor chakra. Bring your left hand down to the right wrist and your right hand down to the left wrist. Yep. And your hand just, you're right there, so just reach down to the wrist.
Which hand goes to?
There, that's left, right? And then move that one. Move the left one first because it's on the spleen. You're just right where the wrist is. Just drop your hand down. Then move your right hand down to the wrist, okay? Yeah, if you want to use a stool, but you know, sometimes it's kind of awkward. So you can do one arm and then the other. You don't have to do them together.
A little better, yeah.
Yeah, if you don't feel that you're going to be able to do it, then do one arm and then the other. It's okay.
Yeah, you can't stand like
Yeah. All right, now move up to the elbows. Move the left hand first. Elbow, elbow.
Much better.
But you could stand on a stool too, or just do one arm and then the other arm. You don't have to do them together. Yeah, you could. But you know, I mean, I would do one arm and then the other. Now we're going to hold the shoulder. So bring, like you did at the hip, bring the left back so you're facing the body. That's it, just like you did the hip. Bring your left hand down to mid-chest at the décolleté and your right hand to the sternum. So now you're on the minor heart and the major heart. Your hands are like this. Okay. With your left hand superior. And then move up to the throat chakra with your left hand. Move the right hand up to the minor heart. So now you're like this. Then the left to the brow, the right to the throat. On the throat, just rest lightly in that suprasternal notch. And I just use 2 fingers. Don't be doing this, okay? They are no longer relaxed. Left hand to the crown, right hand to the brow. Left hand off and hold it up. Right hand on the crown. Picture energy, purple, whatever. And then we're going to swoop down the body and clear their aura. Now, according to polarity, you got to do it 3 times. Yay! Now, you come to this body. Bring your paper. You go, everybody shift 1 table. Shift, come up here. Now the first thing you're going to do is check the space. Make sure the table's the right height for you, so you're probably going to have to adjust it. Stay on the same side because they've moved over for you. Just go like this, 1 body. Clockwise, right? 1 body up. Stand with your left hand superior. Make sure the table's the height that you want before we start. You can adjust it. Place your left hand on the contralateral ankle and your right hand on the ipsilateral ankle. Yep, just like that. Move your left hand to the knee. Move your right hand to the knee. So move up to the knees. Left always goes first, and the right follows. Okay. Now when we go to the hips, we're going to bring that left hand back over here to your side and bring the right across to the other hip. So now you're holding them with your back straight on either side. Try to make it so that your fingers are pointing up on the hip if you can without feeling bad. Now we're going to go to the 7 chakras on the body. So we're going to put our left hand on the root and put our right hand on top of our left hand. So we're going to put both of them on the root. Men or women, don't touch it. Be about 2 inches above. But it's the very end of the torso, so you should be right where the 2 legs start. Now just slide that left hand out from underneath. Now you're holding sacral and root, right? Sacral and root. So they're close together, but they're like this. Now move your left to the solar plexus, your right to the sacral. Slide your left forward onto the spleen. Bring your right up to the rib cage. So now your hands look like this. So one's right behind the other. Now put your left hand on the sternum, go to the major heart, and slide your right hand forward so it's on the spleen chakra. The right just goes where the left just left, okay? We're going to hold that. Now, with your left hand, reach back to the wrist and slide over and hold that wrist. There you go. Very easy. You should turn and face the other way. You'll be more comfortable. Move up to the elbows, left hand first, then the right hand. Hold the elbows. Left hand first, go to the shoulder, then the right hand moves up to the shoulder. We're going to go with the left hand for what's called the minor heart, which is right here, and then put your right hand on the heart. So I'm holding right here, right below the clavicle, and my right hand is on the sternum where the heart chakra is. So I've got both heart chakras. Move the left to the throat and just rest 2 fingers there in that suprasternal notch. And move your right hand up to the minor chakra. So now you should look like this. Left hand to the brow. Right hand to the throat. Left hand to the crown. Right hand to the brow. Resting hand position, just rest your hands on them. Left off, right crown. And then swoop down their body with the energy. And do it 3 times. You want to clear their aura. Ta-da! Move one bed. Check the space. Check the height. People on the table, do you feel okay? Do you enjoy it yet? Putting you to sleep, hopefully? Everybody that's working, take a nice deep breath, sky hook, tuck your pelvis. You can close your eyes for a few seconds. Then we're going to start again, okay? So you're standing where your left hand is superior, right? Reach across, you're going to hold the ankles, left hand goes first. Move the left hand up to the knee and the right hand up to the knee. Now you're usually facing down. Now bring that left hand over to your side. Turn towards you're facing their head. Bring the right hand to the other side and hold the hip. Try to do it with your fingers pointing up if you can. Now bring the left hand to the root and then the right hand to the root. Slide your left hand out up to the sacral, so now they're side by side. Move the left to the sacral, the solar plexus, and the right to the sacral plexus. Slide your left hand forward to the spleen. Bring your right hand up to the solar plexus. So now they're like this. The one's behind the other. Bring your left hand up to the heart. Slide your right hand forward onto the spleen. So now you're standing there like this. Okay. Reach back with the left hand to the wrist. Reach over to the wrist with your right hand. It just kind of, you're right there, right? and hold. Move your left hand first to the elbow. Move your right hand to the elbow. Left hand to the shoulder, right hand to the shoulder. I would lower the table. You don't look comfortable. I would lower it down a little bit. Not you, him. Sebastian, yeah. Left hand to the minor chakra, right hand, the heart, and the right hand to the major. So I've got my right hand on the heart chakra, and my left hand's right above it. It's a minor chakra, but it's also called the heart one. You'll see in some charts that they pick green and pink for the heart. Some places, this should be pink and this should be green. They're talking about both of them. But the minor is a pink color and the major is a green color. So now we're like this. Move up with your left to the throat. Move up with your right to the minor heart. So now you're standing like this. Resting 2 fingers on that throat. Did we do the arms? We did, right? Yeah. Okay. Go to the forehead, left to the forehead, brow, right to the throat. So now we're holding them like this. Okay. Left to the crown, right to the brow. Rest your hand, just let it rest on their body. Left off, right crown. You know, people just normally, naturally do this when they're praying because you're bringing energy into your body. And then we're going to swoop down their body 3 times. Just kind of fan all that out. Get all that energy out of there. We're going to do it one more time and then we're going to switch and then you are going to do it. So find another body. Go that way. Go that way, clockwise. You should be really good this time. You should not even have to think about it this time.
No, still hopeless.
Lower the body, the table, make sure that you'll be able to reach across the body comfortably. They should be close to you. They should be on the edge of the table, not in the middle. Relax, roll your shoulders, open up, okay? Left hand on the contralateral ankle, right hand on the ipsilateral ankle, and breathe. All energy work, spiritual work is all about the breath. Qigong, all about the breath. Tai Chi, all about the breath. Massage, all about the breath. Try doing it holding your breath at the same time. It doesn't work. Bring the left to the knee. Bring the right to the knee. Now bring the left back to your side, hip. Bring the right over to the other side and hold. And try to do it with your hands facing up, your fingers facing up, okay? Now we're going to go to the root chakra. Put the left hand at the bottom of their torso and put the right hand on top. About 2 inches off the body. You guys are too high. You're outside the aura. You got to come down. It's got to, no, your hands. Yeah, you got to be on that 2 inches right there. You're not going to touch them. I have confidence in you.
Just trying to be yourself.
Slide the left one out from underneath and put them side by side. So the left just went to the sacral and the right is still on the root. Then left up to the solar plexus, right up to the sacral. Slide your left hand forward onto the spleen. Bring your right up to the solar plexus. So now they're like this at the bottom of the rib cage. Bring the left up to the heart. Slide the right forward onto the spleen. Go to the wrist with your left hand first, bring it back to you, to your side, and then just let that right hand slide down. It's practically on the wrist already, right? Move the left first to the elbow, and then the right to the elbow. Left to the shoulder, right to the shoulder. Now we stop like this, so we're going to go to the next one. Bring your left to the minor heart. Bring your right to the heart. Left to the throat. Right to the minor chakra. So now we're holding them like this. Left to the brow. Right to the throat. Left to the crown, right to the brow. Left off, right crown. And then swoop. Your turn. Wherever you're at, stop and switch. Whoever you're with, you guys can put your shoes on. You guys don't have to take yours off. Just switch. That wasn't so bad, huh? You could go home and say, you know what? I did a massage today. I did a massage today. Say, do you need your chakras cleansed? So adjust the table height. Have them move close to you. They need to be close to you on the table, not in the middle. So take a minute to look over your sheet.
Where's the sheet? Just get one over there.
Just let whoever was working on you use theirs. Didn't they have a sheet?
There's no sheet.
I don't know. But well, somebody had one, didn't they?
You have the sheet?
Everybody had a sheet.
That's probably not. There's one on the chair over there.
Yeah, that's fine.
Yeah, I think that may be.
So we're just cleansing them. We're just taking everything up and off. Energy goes from the ground up, and that's what we're doing. We're just going up. I'm sorry, what?
Yesterday you said a purple color.
What I picture purple smoke, like big billowing clouds of purple smoke.
And the what do you picture to like create yourself as a grounder, not like dense?
By clearing my mind and only seeing the purple, I'm grounded.
Okay.
I'm grounded, yeah. So roll your shoulders if you have to. We're going to pretend there's a rope and a balloon that's attached to our scalp, and it's pulling us up straight. Pulls us up straight. So your head's going to come back, your neck's going to get longer, and your shoulders are going to drop. Then you're going to take the weight and tuck it back against your spine. So tuck that pelvis. Okay, you can put that where you see it on the table, but if you just listen, you'll do it, okay? Remember, the left hand always moves first. Left hand is always moves first. So reach across with your left hand and hold that ankle. Right hand on the contralateral, the ipsilateral. And try, you can lean against the table if you want, take a break. You know, take a break. Move the left hand up to the knee. Move the right hand up to the knee. Now reach back with the left hand to your side on the hip. Reach over with the right hand, and you're holding the hip like this now. You were looking down, and listen, this is another thing that's really important about massage, is where your eyes are. Which way are you looking? You don't want them to think that you're, you know, doing something wrong. So if you're looking up their body, you're looking right at their crotch. So when you're doing the legs, look down. Because if they look up to see what you're doing, you don't want to, you know, meet eyes and smile because they just caught you staring at their crotch. They look up, they see you concentrating on your work and being respectful of the body you're touching. You're looking that way. Now we're going to get to the hip. Bring that left hand over to you, to the ipsilateral side. Reach up with the right, so now you're holding, now you can look up because you're past the crotch. Now slide the left hand onto the root chakra, which is the base of the torso, and put your right hand on top of it. So you've got them on top of each other, the very bottom of their body. Don't be up here, I mean be close because you want to be within that aural, okay? Now slide the left hand out, leave the right hand there, so now they're right next to each other, right at the bottom of the torso, sacral and root. Move your left hand up to the solar plexus, which is right at the end of the rib cage, and move your right up to the sacral. So they should have that little space between them. Slide your left hand forward to the spleen. Bring your right hand up to the solar plexus. So now they look like that. One is forward and the other one's right behind it. Okay. Bring your left hand back to your side of the body, to the wrist, and let that right hand just fall over onto that wrist. It's because it's right there. Hold on one second. What happened? Did I forget a step? I think I did. All right, go back where the left is on the heart. You were like this, okay? But I thought I did. Anyway, bring the left to the heart and slide the right forward. So you're in this position when we go to the hands. Bring that from the heart, bring it right over to you, because, you know, bring it down, and just slide with the right onto the wrist, because you're like right there. So now you're holding the wrists like this. Move the left first to the elbow and the right to the elbow. Move the left to the shoulder, the right to the shoulder. The left to the minor heart, the right to the heart. The left to the throat, the right to the minor heart. On the throat you can touch them, just be very light. Left to the brow, right to the throat. Left to the crown, right to the brow. Left off, right crown. Swoop, swoop, swoop. Go to the next table. Adjust the table height. You can do a little experiment once you learn to do this a little bit better, and ask the person to tell you what color they saw after you do it. You picture a color and see if they pick up on that and they tell you what color it is. Don't tell them you always love purple. Don't tell them that, because then they'll know. But just see. Just see.
We imagine a color.
Or in the beginning.
I'm picturing a color, and I'm going to ask them, just picture a color. Don't tell me, but picture a color while I'm doing this, because it helps ground you. It helps you relax. And then tell me after we finish what color it was that you picked. Tell them it's their picking. They're picking it. And then see if that was the one you saw too. You want to be able to synchronize, the energy, and usually it works. Or they'll say, all I saw was black, because they can't picture a color because they got like problems. All right, we're going to start at the ankle. Reach across with the left. Put your right hand on the one close to you, contralateral, ipsilateral. Always move the left one first, so move it up to the knee. Then move the right one up to the knee. Where are you looking? You're looking at their feet, and down there, that's where you're looking, right? Now bring the left hand back across to your side on the hip and reach over with the right and hold the hip. Now you can look up. It's okay. Turn facing up. Okay. So we're like this. Now bring your left hand up to the root and put your right hand on top of it. Just slide that left hand out from under so they're side by side. Now you're on the sacral and the root. Move the left up to the solar plexus, the right up to the sacral. Slide the left forward along the rib cage to the spleen. Bring the right up to the solar plexus. So now one is behind the other. Okay. Bring your left up to the heart. Slide your right down to the spleen. So you're standing like this. Okay. Reach back for the wrist, and then just let that hand just slide over and grab the other wrist. Hold on one second, let me see. So it was like that, like this. Okay, so you were twisted.
Okay.
Yeah, this hand is here and this hand is here. Okay. Yep. Left hand first, go to the elbows. Move up to those elbows. Left hand to the shoulder, right hand to the shoulder. So you should be holding them like this, right? No kissing, you can't lean over and kiss them. You can think it, but don't do it. Bring the left to the minor chakra and the right to the major heart chakra. So now you're like this on the chest with both of your hands. Bring the left to the throat, bring the right to the minor heart. Bring the left to the brow, right to the throat. Left to the crown, right to the brow. Left off, right crown. And swoop. People on the table, did you pick a color? Did you see colors? Did you see black? Anything? All right, move over, go to the next table. Bring it up, that's a little too low. A little too low. Now on the legs, we're going to be looking down towards the feet, right? That's how we're turned, looking down towards the feet. Reach over and hold the ankle with your left hand. And put your right hand on the ipsilateral ankle. Left to the knee, right to the knee. Now reach back to your side with the left hand and reach over with the right hand. So now we're holding the hip like this. Now you can look up. Left hand on the root, right hand on the root. Slide your left hand out to the sacral, and now they're side by side. You're holding sacral and root. Left up to the solar plexus, right up to the sacral. Slide your left hand forward onto the spleen. Bring your right hand up to the solar plexus. Left hand to the heart, right hand to the spleen. Bring your left hand down to the wrist, right hand to the wrist. Left hand elbow, right hand elbow. Left hand shoulder, right hand shoulder. Left hand minor heart, right hand major heart. Left hand throat, right hand minor heart. Left hand brow, right hand throat. Left hand crown, right hand brow. Left hand off, right hand crown. Swoop. My granddaughter is so cute. When I try to see if she's going to see colors and stuff, she always says, "It's confetti. I see confetti." Move around. Fix the table if you need to for the height. We're going to start at the ankle and be looking, turn your body so you're looking down. Okay. Left hand across the body to the ankle, right hand on your side. Left hand to the knee, right hand to the knee. Bring the left hand back to your side and hold the hip. Reach over with the right hand and hold the hip. Now you can turn facing up. Left hand on the root, right hand on the root. Slide the left from under to the sacral, and now they're side by side, sacral and root. Move the left up to the solar plexus, move the right to the sacral. Slide the left hand forward to the spleen, bring the right hand up to the solar plexus, so they're one right behind the other. Bring the left to the heart, slide your right to the spleen. Reach to your side for the wrist with your left hand and just slide your right hand down to the wrist. Left hand to the elbow, right hand to the elbow. You should be, yep, wrong, yeah, wrong, there you go. Left hand first, go to the shoulder. Bring the right hand up to the shoulder. Bring the left hand to the minor heart and the right hand to the major heart, so they're right next to each other. Left to the throat, right to the minor heart. So now you're up at the upper chest like this. I'm not going to say anything. Walk the rest of them. Where do you go from there? Brow, throat, exactly. So bring your left hand up to the brow and then your right hand onto the throat. Just walk it off. Walk it off, okay? Always move the left hand first, then move the right hand.
It's good if you're just relaxed enough that you don't even notice.
It is relaxing. All right, a couple of you got the hands mixed up? Okay, when I, look guys, when I go to the arm, I am in this position before I go to the arm. My right hand is on the heart. My right hand is the spleen, and my left hand is on the heart. And what I do is I just reach back and reach over, okay? Reach back and reach over. Some of you have your arms twisted. From here, you go like that, okay? Left hand from the heart to the opposite wrist so that you're walking up them over, not twisted, okay? Go to the next table. You have to do it 4 times because they did it 4 times. Adjust the table height, warm up those hands, no fair touching with cold hands.
Yeah, look at your hair. That looks like it would have been.
We're going to start at the ankles. Reach across with your left. Put your right on the ipsilateral one. Look down. Bring the left to the knee, bring the right to the knee. Now bring the left back to your side and reach over with the right and hold the hips. Now you can face up. Put the left on the root, put the right on the root. Slide your left out from under to the sacral, so now they're side by side. Move the left to the solar plexus, move the right to the sacral. Slide the left hand forward, bring the right hand up. Left hand to the heart, right hand to the spleen. Reach back to that wrist and just reach over to the other wrist because it's right there. Left hand first, go elbow and elbow. Left hand first, go shoulder and shoulder. Left hand minor heart, right hand major heart. Left hand throat, right hand minor. Left hand brow, right hand throat. Left hand crown, right hand brow. Left hand off, right hand crown. And swoop. People on the table, are you feeling more relaxed each time they do it?
Of course.
Little more energy?
I feel good.
This is something you do at the end of the massages every time?
Or the beginning. I mean,
Oh.
if they come in and they're totally stressed out, I might do this to get them before they can even get a massage without climbing the walls,
Like
right?
in yoga, namaste.
Tell me if you feel anything at all when I hold your ears.
I feel it on the right ear touching.
Feeling warmer?
Yes.
Little tingly?
No, I feel warm on the right ear though.
Any tingly?
No.
But warmer?
Yeah,
right?
warmer, yes.
You try it.
Okay.
Just hold right above the ear and cup it. Just cup them without touching them. Yep. People on the table, see if you feel a difference, if you feel like they're warming up. You, person holding, picture your hands warm. You feel warm hands. Your hands are hot. You feel it. And then people on the table, tell them if their hands are getting warmer. And then just come straight off. Don't go up, just go straight off. Mind over matter. You want to be able to think about bringing blood into your hands because you're a massage therapist. Nobody likes cold hands, right? We can have some, if you drink water, bottled water, bring in a bottled water, empty one, and we're going to fill it with hot water, and you're going to keep it at the table and then refill it whenever you need it. But you need to keep holding it if you have cold hands, because that's your job to fix those cold hands. If you say, I'm so sorry, my hands are cold, and then you touch them with a nice cold hand, insult and injury, right? It's bad enough that they're cold, but you tell them I'm going to touch you with cold hand. You know they're cold, and you didn't do anything about it. Hot water is right there. Bring a bottle in. All right, we're going to help them up. I should have done this with the other guys. Do a sacral rock. Remember how to do the sacral rock? First of all, you got to get the bolster out. And we'll let you get back on. Just do it one time. Take the bolster out from under their legs. Now, I'm going to instruct, don't do it. Just do it when I say what to do, right? You have to hold really close to their legs to pull it down. There you go. Now, ask them to bend both of their knees up and bring their heels as close to their bottom as they can. Reach across with your inferior hand, proximal lateral knee. You're holding over there like that. And you want your forearm to touch them. You want to really be holding those legs. Now you're going to tell the person on the table that you're going to sit them up on the count of 3. Put your hand next to their neck and then tell them to lift their head. You got the head and the knees, right? Tell them, we're going to sit up, 1, 2, 3. Swing your legs.
Swing your legs.
You got to tell them to swing their legs. All right, switch. Other person get on the table. No, we're going to sit up. No, we're going to sit up. First thing, tell them to bring both of their knees up, put their feet as close to their butt as you can. Inferior hand, reach across, hold right below the knee on the outside. Tell me how I'd say that technically.
Contralateral knee. On a count of 3.
Not proximal, distal to the knee because you're below it, right? Okay. Now look at them and tell them, we're going to sit up on the count of 3. Lift your head up. Have your hand already there. Grab their head. Okay? Now, tell them we're going to sit up, 1, 2, 3. Swing your legs. Ta-da! And, you know, kind of stand there for a minute, because if they start getting dizzy, you got them, and you got their neck and their leg, they're not going anywhere.
Oh yeah. Which way?